Former President Joe Biden's recent diagnosis of prostate cancer has brought this into the limelight. Prostate cancer, quite common in men, as 1 out of every 8 will develop it sometime in their lifetime, statistically speaking. To help us understand more about prostate cancer, we welcome our medical expert, Dr. David Winter. Dr. Winter, I appreciate you joining us today. This, as I just mentioned, is a pretty common cancer. Why do you see those rates as high as they are?
Mark, there's been lots of research trying to find the answer to that, and we actually don't know. The majority of men who get prostate cancer have no risk factors. Now, a minority do have risk factors. If your brother, father, grandfather had it, you're at increased risk. If you have the BRCA gene, they're at increased risk, and African-American men also at increased risk. Now, here's one thing we do know. Prostate cancer comes in 2 varieties. One is very aggressive and frequently deadly. Another is more indolent and milder, Mark.
How do you tell the difference between those 2 forms?
Yeah, ultimately you have to look at it under the microscope. And when you do, you'll see some of these rapidly growing, rapidly dividing cells. Those are the ones that can cause big trouble. Others are more indolent. And with those, we often don't have to even treat that. We do what we call watchful waiting. So it's important to find out if it's aggressive or not aggressive before you even talk about treatment.
You mentioned the BRCA gene a minute ago. I've done some stories on similar genes that can be fairly predictive when it comes to breast cancer, and I know a lot of women will undergo some of that genetic screening. Is that something that's recommended for prostate cancer as well?
Well, if you have that gene, indeed you are at increased risk of breast cancer and prostate cancer. That's something to look for if it tends to run in your family, that BRCA gene does, yes.
How often should men be screened for prostate cancer? At what age do doctors recommend these begin?
Yeah, we've actually changed that age. It used to be up at age 55. Now we say at age 50 for most men. If you have the risk factors, family history, BRCA gene, African American, maybe age 45, and then perhaps every year. The key is to try to find it early and then to figure out what we need to do to treat that. And the way you do that is early detection. PSA is the best way to find that.
Now, I saw in the graphic there that for men over the age of 70, that PSA antigen test not recommended anymore. I know for a lot of years it seems like you did hear about that quite a bit. Did something change with regard to those recommendations?
Yeah, that's still out there. And I guess if you're 70 and frail, that's something that you would consider not looking at. But for other men, we still look at that. You look at Joe Biden. He's up there in the years. He has an aggressive cancer. Could he have been treated better earlier? Probably. So that's an individual decision you make with your physician, when to stop testing and when to look at the PSA and what to do with that. Because the PSA can go up for other reasons also, Mark. Prostate infection, injury to the prostate gland. As we age, it gradually increases also. So it takes some deliberation to figure out when to treat and what to do about it.
And real quickly, I do want to get this in for anybody who has not been tested. Are there any warning signs they should look out for when they should think, hey, you know what, maybe I should call my doctor?
You know, early prostate cancer has actually no symptoms. That's the problem. That's why screening is so important.
Okay, great information as always, Dr. David Winter. Thank you for joining us.
Thank you, Mark. Always good to be with you.